a silverfish, right? They say la cucaracha. It's not the silverfish. The silverfish isn't a fish at all. I don't know the rest of the
It's
words.
still all so fresh. His photo was just placed here on the ofrenda. The flowers in their Coronado home haven't wilted yet. It hasn't even been a month since Patricia Poncefeliu lost her husband Jaime to cancer.
And sometimes the waves of sadness are little and you can, kind of step over it, and then sometimes they just come and then knock you over.
Jaime had served in the Navy for 20 years. He was a runner and an avid athlete. In August of 2021, he was diagnosed with esophageal cancer. Then this spring, brain cancer. For Patricia, it's been a hard few years. She lost her very close friend Tammy to cancer, and seeing her 69-year-old husband in the same pain was tough.
He wanted out. He had even said, like, if I had a gun, I probably would do something because I am in so much pain.
Patricia says a family friend told her about the medical aid in dying practice that is legal in California.
No one does this unless they're suffering, and they're suffering to a degree that is unacceptable for them.
Patricia found Dr. Bob Ulander online. He owns and operates a private San Diego-based clinic called Empowered Endings. He and his staff offer palliative and hospice services. And he is willing to write a prescription for a terminally ill patient to obtain a life-ending medication. It's a lethal cocktail of medication that comes in a powder form and is mixed with a few ounces of liquid.
How many prescriptions do you think you've written?
At this point, somewhere between 500 and 600.
And do you know how many of the patients have actually gone through with it?
About 2/3.
California law states there are several requirements. A patient must be 18, mentally competent, have a diagnosed terminal illness with 6 months or less to live. 2 doctors have to sign off on that diagnosis, and among other regulations, the person must be able to administer the medication themselves.
The law is very clear that it's not considered suicide, which is very important because there are some life insurance policies that would negate the insurance for people who have committed suicide. And these are people who, given the option, they would choose to live, but they don't have that option because they have a medical condition that's ending their life.
Dr. Ulander started in medicine as an ER doctor. He acknowledges that the Hippocratic oath he took to practice medicine states in part, "Do no harm."
To me, when there's an option for them to choose to reduce their suffering, eliminate further suffering, and we don't give them that option, to me that's more harmful.
I think anybody who's been in a situation where they've had a loved one who's seriously ill can understand why there's a desire to really minimize the pain and the suffering. They don't want to be a burden on their family.
Dr. Les Cochran has been a hospice and palliative care doctor since 2004. He was a traveling doctor for years and currently practices in Murrieta.
I never question anyone's compassion, but compassion does not always cause us to make wise decisions.
Dr. Cochran says he assures all of his patients that he will make sure they are not in pain at the end of their life.
We can reassure patients and families that your pain and your symptoms can be brought under control. It's never medically necessary to kill a patient in order to achieve that objective.
Dr. Cochran was a part of a lawsuit brought against the state of California over a 2021 revision to the End of Life Option Act, which many doctors say ultimately forced them into complying with the practice. The court sided with Dr. Cochran and the Christian Medical and Dental Association.
At this point in time, doctors in California are not required to participate in physician-assisted suicide, but it is likely that we will see future challenges as another law could be written that could erase that.
What the 2021 revision did change was the waiting period. It used to be 15 days. Now a patient can get the medication 48 hours after meeting the requirements.
2 days. 2 days. I cannot tell you how many patients I've seen that were in terrible pain, and 2 days later, we had their pain and symptoms under control.
Dr. Cochran says among the ethical and moral arguments about the issue, he believes there's also a financial component to this that he says spreads beyond patient care and into medical prevention.
If you think about a disease like Lou Gehrig's disease, which is terrible, and there's ongoing research to try to figure out how to cure it. Well, if you essentially make the cost of death very inexpensive and very accessible, where will the pressure be to continue to do research?
The standard fee is $5,000. We work on a sliding scale, so those who can't afford the standard fee pay what they can.
Dr. Ulander says because he's in private practice, he has to charge his patients who are able to pay. He says much of the fee pays for qualified care, which includes registered nurses, doulas, and mental health professionals. Patricia says the entire family was at peace with Jaime's decision to ingest the medication. She and his 3 adult daughters placed flowers and sat at his bedside.
The last sense to go is your hearing, so we wanted him to listen to us just talk, and we were laughing and telling stories. And then an hour later, the social worker said that he was gone, and then we really cried.
She says while his physical suffering is over, the grief over losing his light is just beginning.
You, in your heart, in your faith, feel is the right thing for you. And for us, this was the right thing.
Heather Myers, CBS 8.